Welcome to ASWB MSW exam practice test. Our topic today is practice test 4. Use the link in the description to download the app on the App Store for free practice tests. Number 1. During which period of child development would the evidence of childhood psychopathology most likely to become apparent? A. Physical development. B. Cognitive or intellectual development. C. Sexual development. D. Language development. The correct answer is D. Language development. Explanation. This developmental period requires mastery of phonology, making sounds correctly, semantics, the encoding of messages, syntax, proper combining of words, and pragmatics, proper use of word context. Because of the complexity of language development, some forms of psychopathology like autism are more readily apparent in this developmental phase. Irregularities in physical developmental milestones are more likely to identify congenital defects, while poor cognitive development may more readily reveal genetic and drug exposure issues. Sexual development requires careful parenting to ensure sexual curiosities are properly directed in socially appropriate manners, while also ensuring that emerging sexuality is not shamed or otherwise impaired or distorted. Number 2. Roberts, 1991, has proposed a widely used crisis intervention model including A. 3 stages, B. 5 stages, C. 7 stages, D. 9 stages. The correct answer is C. 7 stages. Explanation. Roberts, 1991, proposed a 7-stage model for working through a crisis. Stage 1, Safety and Lethality Assessment, accomplished through a biopsychosocial assessment, including supports, stressors, medical issues, medications, substance abuse, coping skills and resources, as well as suicidality with or without real intent and a plan, history of past attempts, and related risk factors, substance use, isolation, and recent losses. Stage 2, Establishing rapport, ideally through the assessment, facilitated by warmth, genuineness, and empathy. Stage 3, Problem identification, current issues and any so-called last straw in order of working priority. Stage 4, Address feelings, validate via listening skills, paraphrasing, reflective listening, and probing questions, and challenge maladaptive beliefs. Stage 5, Generate alternatives, explore options and include client input on what has previously been helpful. Stage 6, Develop an action plan, shifting from crisis to resolution processes, using steps identified in the prior stage, and helping the client to find meaning in the crisis event. Stage 7, Follow up, a post-crisis evaluation of client functioning and progress, via phone or in-person visits at specific intervals. Number 3. Which of the following is a perpetrator not likely to express during the reconciliation phase of the cycle of abuse? A. Threats of further abuse. B. Blaming the victim for the abuse. C. Apologizing for the abuse. D. Minimizing the abuse. The correct answer is A. Threats of further abuse. Explanation. The 4 phases of the cycle of abuse are: Phase 1, Tension building. Phase 2, Incident. Phase 3, Reconciliation. Phase 4, Calm. During the reconciliation phase, the perpetrator is seeking to re-establish stability in the relationship. Added threats would not accomplish this. Thus, expressions tend to center on apologizing for the abuse and giving excuses for the abuse, for example, I was drunk or upset by something else. More aggressive reconciliation tends to be limited to blaming the victim for the abuse, minimizing the level of the abuse, or denying that the actions were at all truly abusive. Number 4. Working at a bicultural community counseling center for Southeast Asian families, you encounter a family troubled by sharp divisions between older family members and their young children. In particular, from the parents' viewpoint, the children seem to have lost respect for their elders, often treating their parents and even their grandparents in dismissive ways. According to Robbins, Chatterjee, and Canada, 1998, what does this case indicate? A. Traditional adaptation. B. Marginal adaptation. C. Assimilation. D. Bicultural adaptation. The correct answer is C. Assimilation. Explanation. In developing a bicultural identity, assimilation occurs when the norms and values of the sustaining system, institutions and society are learned and followed to the exclusion of the norms and values of the nurturing system, family and cultural roots. This division can be particularly problematic among new immigrants and their young offspring. The parents, especially those from highly divergent cultures with markedly different languages and traditions, often find themselves unable to function well in mainstream society. Consequently, they become significantly dysfunctional in the eyes of the children, who far more quickly learn the dominant language and ways. As the parents turn to their young children for help in interpreting and guiding them through systems and technologies, traditional values of respect and reverence for adults can be significantly diminished. Traditional adaptation exists where adherence to the nurturing system, family and culture, remains dominant. Marginal adaptation occurs when neither the nurturing nor the sustaining system's values and norms are followed. Bicultural adaptation exists when the norms and values of both systems become functionally integrated. Number 5. Which of the following do social workers not need to be sensitive when considering issues of cultural diversity? A. Race and ethnicity. B. Employment class. C. Gender and orientation. D. National origin. The correct answer is B. Employment class. Explanation. While employment and employment class may be relevant to a number of important social work endeavors with any given client or family, it is not generally considered an issue of cultural diversity. Primary areas of cultural diversity include 1. Age, particularly as related to elderly persons. 2. Sex, particularly as related to issues of feminism. 3. Gender identity and expression, specifically involving LGBT issues. 4. Ethnicity, common cultural and sometimes physical characteristics. 5. Race, biologically determined common traits. 6. Skin color, often not actually race-based. 7. Religious beliefs and affiliations, to include spirituality and not just religion. 8. National origin, country of birth. And 9. Disability, a physical or mental impairment that significantly impairs life activity. Social diversity can be expanded to include marital status, political beliefs, social organization membership, educational status, and socioeconomic class. Social workers must be sensitive to cultural and social diversity to work well with a wide variety of clients and have special awareness of their limitations in these areas. Number 6. A client arrives for services at a community counseling clinic. He is pleasant, easily engaged, and discusses the need to work on some interpersonal problems. When asked about any prior treatment, he notes that he has been seen by another therapist for the past 8 months. However, he now needs to seek services closer to home due to a change in his work schedule. When presented with an information release for contact with his prior therapist, he becomes agitated and upset and refuses to allow the contact. Which of the following would be the best response in this situation? A. Accept the client's need to keep his therapeutic past private. B. Discuss his concerns and support him, but require the collateral contacts. C. Refuse services to the client based on his refusal to permit collateral contacts. D. None of them. The correct answer is B. Discuss his concerns and support him, but require the collateral contacts. Explanation. It is important to create a therapeutic bond with the client, but not to the exclusion of collateral contacts that are reasonable. The client should be given every opportunity to discuss his concerns, particularly if the therapy ended badly, and he should feel well heard and supported. Further, some collateral contacts, such as with a bitter ex-spouse, can very understandably be refused, but an extended therapeutic relationship should not be circumscribed by a client, as crucial information could be lost and the therapeutic work be thwarted. Number 7. Referring to a record charting method, what does BIRP stand for? A. Behavior, intensity, reaction, and plan. B. Behavior, interpretation, recapitulation, and plan. C. Behavior, intervention, response, and plan. D. Behavior, insight, repetition, and plan. The correct answer is C. Behavior, intervention, response, and plan. Explanation. BIRP stands for behavior of the client, intervention from the behavior, response to the intervention, and plan, next steps in light of the behavior intervention outcome. Number 8. When used in reference to an individual who is chronologically at least 4 years old, or mentally, at least 4 years old, what does the term encopresis refer to? A. The voluntary expelling of fecal matter in an inappropriate place. B. The involuntary expelling of fecal matter in an inappropriate place. C. The expelling of fecal matter in response to symptoms of stress or anxiety. D. All of them. The correct answer is D. All of them. Explanation. Encopresis refers to incontinence of bowel in an individual who is at least 4 years of age, chronologically or mentally. It may occur due to stress, anxiety, or constipation, as oppositional or retaliatory behavior, and it may be either voluntary or involuntary. It must occur at least monthly for 3 consecutive months. It must not, however, be due to a neurological, medical, chemical, or substance-induced disorder or stimulant. The term for similar problems with bladder incontinence is enuresis, which has similar diagnostic features, with the exception that bladder incontinence must occur at least twice a week over 3 consecutive months. Number 9. A 34-year-old man makes an appointment to see you for help coping with a difficult relationship in his life. At intake, you learn that he feels a famous movie actress has hid an affection for him. He has written to her many times through her fan club and has received letters from club personnel, never from the actress herself. But, he explains, this is just because she's not currently free to express her feelings openly due to a waning relationship with a wealthy businessman. When talking about the businessman, there are clear feelings of competition. When asked for greater detail or information to buttress his beliefs, he avoids the questions. Which type of delusional disorder would be the most appropriate in early diagnostic impression? A. Grandiose type. B. Jealous type. C. Persecutory type. D. Erotomanic type. The correct answer is D. Erotomanic type. Explanation. The client openly indicates that this famous person has loving feelings for him, although they've never met or directly communicated in any way. Classic features of erotomania include identification with someone in higher status and is more common among women than men. The symptoms are not infrequently manifest in either schizophrenia or bipolar mania, at which point either would be the proper primary diagnosis such as bipolar, acute manic phase, with erotomanic features. Grandiose type is not correct as it focuses on a client's belief that he or she has special talents, unique understandings, or an unrecognized or unreported extraordinary accomplishment. Jealous type is not correct, as the inordinate jealousy must be centered in faulty perceptions of infidelity in a real relationship. Persecutory type is not correct, as it focuses on a fear of a conspiracy by others to do him harm. Number 10. What is the key difference between bipolar 1 and bipolar 2? A. Bipolar 1 involves mania, and bipolar 2 involves primarily depression. B. Bipolar 1 involves primarily depression, and bipolar 2 involves mania. C. Bipolar 1 involves hypomania, and bipolar 2 involves dysthymia. D. None of them. The correct answer is A. Bipolar 1 involves mania, and bipolar 2 involves primarily depression. Explanation. Bipolar 1 disorder requires a minimum of 1 manic episode, or mixed episode, as well as episodes with features typical of major depression. In contrast to this, bipolar 2 requires at least 1 major depression episode and a minimum of at least 1 hypomanic episode. Adequate control requires medications. Preferred treatment medications more commonly focus on atypical antipsychotics, which provide greater symptom relief than the older mood-stabilizing medications such as lithium, Depakote, or Tegretol. These are now more commonly used only as adjuncts. An extended depressive episode may also be treated with antidepressants. Education about the condition, as well as therapy such as cognitive behavior, interpersonal, social rhythm and family therapy, greatly enhances successful management. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.